all of our hospitals have visitor restrictions in place. That's because of all the sicknesses going around. 29 hospitals are limiting the number of people who can visit loved ones over the holidays. News Center 7's Taylor Robertson joins us live outside Kettering Health in Troy. And Taylor, the last time the hospitals did traditional visitation restriction was before COVID.
That's right, Gabby, and I talked to a woman whose sister had to give birth to her child without any family in the room, including her husband in 2020 during the COVID surge. She feels like restrictions like this are especially hard on the patients who will have to spend Christmas inside of one of these hospital rooms.
I mean, if I put myself in the shoes of the person in the hospital, I feel like that's extremely isolating.
She told me her sister and brother-in-law really struggled with the fact that he could not be with her during the delivery.
I feel like that was such a significant loss for them.
On the other hand, she understands the concern of spreading sickness such as COVID, RSV, and the flu to patients or staff inside the hospital, which is the infamous trio that the president of the Greater Dayton Area Hospital Association, Sarah Hackenbracht, told me is hitting our hospitals hard.
We've started to move up in terms of from low to medium to high influenza-like symptoms across the region, and we're seeing overall an increase in respiratory illnesses. It's all of those things happening simultaneously that are impacting our hospital capacity.
And she said it's important to keep hospital staff healthy so they can show up to treat patients who need them.
There are also members of our community. They also have families. And so there are also times where they might need to be the caregiver at home to take care of a young one with RSV or to take care of an elderly or aging parent who needs direct care and hands-on care in the home.
The restrictions prevent anyone who has symptoms such as cough, fever, or sneezing, or anyone 14 years old and younger from visiting people in the hospital.
And we do this because it really allows us to ensure that we can protect the community that we are there to provide care for, and then ensure that our workforce is healthy and able to be in our hospitals, to be at the bedside when we need them.
She told me that they do understand that it is really hard for people to not be able to visit their family or friends in the hospital over the holidays, but patient and staff safety is what's at the top of their priority list. We're live in Troy. Taylor Robertson, News Center 7.